All right, let's go ahead and open up the doors to Daily with Doc, if you would please, my co-hosts. Welcome back, everybody. My name is Becca Dukes, and I am honored and excited to be able to bring to you empowering information that gives you more knowledge, more things to put into your tool belt as you are going through life, working on creating the best optimal you that you can be. Now, we focus a lot on health, a lot on nutrition, and there's some other things that we can do that allows us to be able to see what's going on inside so that we know how to respond to best fit what our body needs. And today's guest, I am super excited to be able to introduce to you. But before I do, I just want to remind you that this program is being sponsored by DailywithDoc.com. We are a resource for an amazing community of health coaches and people that are health enthusiasts and health advocates. So if you were invited by somebody specific to this program, make sure that you get back with them. They took the time and cared enough to share this program with you. We want to make sure that you stick with them and they stick with you. So if you have any questions about what you hear today or about anything that would help you meet some of the deficiencies that may be going on in your own health, get back with the person that shared this program with you. If there is nobody to thank, you found us on your own, you have never spoken to anybody about longevity or the products or Dr. Wallach, then make sure that you feel free to reach out to us. I do have a call team specifically for those individuals that are not working with somebody at 855-949-3377. Again, that's 855-949-3377. Now, on to today's show. Okay, so there's a lot of things that we can do to take a look into what's going on within the body. And today's program, we are honored to have with us Dr. Gregory Melvin, who has really gone pretty deep into this whole thing called thermography, thermal imaging, looking at different things within the body. And we're going to find more out about that. Now, Dr. Melvin is also a doctor of chiropractic. He has been doing chiropractic for many, many years. He's been instrumental in this whole thing called thermography and imaging. And from my understanding, he's even written some instruction books on it. So without further ado, if I could get Dr. Melvin spotlighted here with me. Thank you so much, Dr. Melvin, for being a guest with us. Let me add me. Okay, how come I'm not able to add? There we go. I got it right. You've done so much with thermography. Tell us a little bit about first yourself and how you got into the field of wanting to help people, period. And then let's go into thermography.
Oh, thank you for having me, Becca. I've been doing chiropractic since I went into chiropractic college when I was 17 and grew up. All of us were born at home. Never had a vaccine, never had aspirin. So we had a little bit more faith on what we're born with to help us live healthy. So that was, so the idea of using infrared actually came along many years later. About 1991 is when I first looked at thermography. Prior to that, I was doing x-rays, but I was doing digital films that I would color enhance the films to understand where the higher densities regarding x-rays. So And then it went from there to doing infrared. Back then, we were using a Dorex unit, kind of archaic now, where you put liquid nitrogen into the reservoir, and you would take these thermal images, and then it was the state of the art. But of course, it's gone far beyond that now.
So you've seen it evolve quite a bit.
Yeah, I have.
And
Yep.
what were you going to say? I'm sorry.
Well, even back then, what they used to do, cholesteric latex, where they would put a like a mood ring onto the body, and then they would take a Polaroid of that image. And so, yes, it's gone through some great strides today.
So now looking at today's thermography and thermal imaging, would you say that you can use those words interchangeably, or are they two separate subjects?
No, thermography, its original term, can be interlaced with infrared, and those originators of how infrared was discovered was the beginning of thermography. But it wasn't until 1954 where the first imaging for breast was performed by Dr. Ray Larson out of New York.
So you said 1954
Yes.
for imaging for breast. Now, what type of imaging was it? Was that the thermography type imaging?
Yeah.
Okay.
Yeah. Infrared or thermography is saying the same thing.
Okay. So this is October, breast awareness or breast cancer awareness. So let's go a little bit into that, Dr. Melvin, because I know you have a little bit of experience in using thermography for women's health, including that concerns the breast. So tell us the benefits of the thermography over some of the other options, if you don't mind.
Sure. Yeah. Well, I think first of all, it's understanding why skin temperatures. How does that work? Why does it work? It starts with the idea that, number one, the fetus, the development of the fetus, that the skin and the central nervous system originate from the same fetal tissue. And as you know, there's 3 different sections to the fetal tissue, in that what is on the outside of the body is literally hot wired to a part of the brain called the hypothalamus. Hypothalamus is what coordinates the blood flow to every muscle, organ, and gland by way of the, can I use these terms this way, Doc?
Yes.
Okay. In that, by way of the sympathetic nervous system, is how it coordinates not only the blood flow to every muscle, organ, and gland, but it reflectively produces a change in skin temperature that is consistent with the body part being affected. So that's basically identifying inflammatory, lymph congestive features, um, estrogen dominant characteristics. These are the 3 areas that you can't see on a mammogram or an ultrasound or an MR. None of those have that capability. The basic fundamental of diseases is inflammation. And when you can't see it, sometimes it's very difficult to identify. So C-reactive proteins, a means of identifying inflammation within the body, but it doesn't tell you where it is.
You brought up a very good point, because a lot of people, they'll go to the doctor, they have all these things going on, the doctors can find nothing.
Yeah.
Where thermography looks at things that the doctors aren't even considering, that could then help somebody in the way of the direction that needs to be done in order to start addressing what's their cause is, especially, you got blood work, nothing shows anything. Urinary or urine testing, nothing shows it. MRIs, nothing showing. And like you just said, the thermography, it's measuring temperatures with the different layers that then.
Layers?
So you said that there were 3 different layers of tissue.
Yeah, no, there's 3 particular instrumental identifications, especially regarding breast imaging, is inflammation, lymph, congestion, estrogen dominance. Those are the 3. Yeah.
And it's able to measure temperatures that are associated with those things?
Well, and yes, and it was Johns Hopkins University that did a study back in 1991 regarding what is a normal skin temperature. And it's not absolute temperatures as much as it's relative temperatures. So that would mean you measure the average temperature of one area of the body, and then you would take that parameter and measure the opposite side. So Johns Hopkins University by Sumo Uematsu, Dr. Uematsu had identified that we are almost a mirror image of ourselves on one side compared to the other. So it gives you an understanding of the physiological characteristic comparing them to them, where most tests like blood evals, urine tests, they do a national average and then expect you to fit within that parameter, where this is has more specificity regarding your body's function.
All right. So folks, this is something that I think people should really consider looking into. And I know Dr. Wallach talks about it, limiting, the exposure to radiation and what happens with like x-rays. Yeah. And thermography is one of those options.
Yeah, so it's basically taking a picture of the heat radiation, the infrared that's coming off of that body. And so those patterns, whether they're lymphatic related, so your anatomy background must be such that you know what the depths of that body part is and what does it correlate, that heat pattern, where hot patterns are equally as important as cold patterns. And so the thought that the hot patterns are what we're especially interested, no, we're equally as interested as the colder patterns are usually more neuropathy related, things like Bell's palsy. Very easy to see the continuance of Bell's palsy, and it'll look like a colder mask pattern on one side compared to the other.
Interesting. So with Bell's palsy, that has to do with nerves also?
Yes.
And if they're not functioning properly, then things start to droop. But then you're also able to see it through temperatures.
Yes. Yeah, and you'll see when you get a deficiency in neural control from a 7th cranial nerve on one side, you'll see the muscular contraction on its opposition. So you'll see a muscular pattern, which is a higher temperature, but the area of particular interest is the lower temperature in this particular case, or any things like RSD, reflex sympathetic dystrophy, where you do a nerve conduction testing. You do a nerve conduction testing will only tell you if there's a motor or sensory nerve deficiency, where the autonomic nervous system isn't examined with the nerve conduction testing. So frequently in motor vehicle accidents and slip and falls, back in the 90s, the early 90s, they were using this form of testing to identify soft tissue injuries that were not overt enough to be picked up with MR or CT. So the size of the lesion would have to be a certain size. So the basic feature of sprains or strains, there's nothing to see with an MR or CT scan because it's a microscopic, vast tearing. But the autonomic nervous system does respond, and it responds when there's trauma. You'll see temperatures that will significantly identify what part of the body was injured.
All right. Now you have a presentation and some slides to show with us today, don't you?
I do. I think what I'm going to do is open up my side. I'm just going to go down to imaging. I think people just want to know what does the imaging look like. And so can I share my screen now?
Yes. Go ahead and do a screen share. And then select whatever screen you want to share.
It says entire, and I'm clicking on it. It's not allowing me to. I'm going to do it again.
Okay. And folks, while Dr. Melvin is getting the screen share set up, I just want to thank you all for joining us here on Daily with Doc. I keep getting these questions. Is Doc okay? And folks, yes, Doc is fine. He has been pushing it for decades and just needed to take a break. And so CEO Steve Wallach, who we had on Friday, and his wife said, you know what? Doc's taking a break. So that is from phone calls, from Zooms, everything. He is taking a much needed break and just recovering, regenerating, and he'll be back on with us in a few weeks, we're hoping. So, all right, now we have,
No.
let's see. Nope. So that's a screen share of us. So go ahead and pull up your,
Can you?
pull up your presentation.
It's saying stop sharing.
Oh. Yeah.
Yeah, let's go ahead and stop share for a moment
Okay.
until you get that pulled up there. And I love the fact that we have people that have ability to help us figure stuff out.
Huh?
It says entire screen,
Yeah. Yeah.
but it's not letting me click on there.
Can you go?
So can you choose just the presentation software that you have your presentation in? Do you have that open? It has to
No.
be open first.
Yeah.
Oh, I see. I see.
So once you have it open and the presentation up, then you should be able to go back to share screen.
Yeah.
You can't do it.
You can't slide this whole thing.
No, you can't.
So, all right. And so we do have people that are putting in questions out on YouTube and also here in the Zoom room. If they are pertaining to today's topic, then we will definitely get those questions asked as time allows. And for those that are not, make sure that you go to Daily with Doc, use that contact us, submit your questions there, and we will get questions answered. So folks, we're not forgetting about you. That there's been a lot of questions coming in. So bear with us as we go through all the questions that are coming in. And again, if it's in regards to, specifically what's going on with Doc is fine. He just needed a break. Okay. I think of anybody in this whole entire world, he deserves it most right now. So I'm so thankful that we're able to give him a break and still continue bringing you information that is empowering, that's adding things to your toolbox so that you yourself can do so much in making sure that you are getting what the body needs. So we're going to pop back over, and Dr. Melvin, if you want to go ahead and unmute yourself. All right, I saw it for just a moment. And gonna have to, let's see if we can get the video started again and microphone back on.
Can you hear me?
I can hear you, but we can't see anything right now. Shows, and then your
Share screen.
computer is
Stop sharing it.
Okay.
So we're gonna go back over here. Did we close it out?
Yeah, it's closed out. It's a move.
I also saw that your video is off as well.
Okay.
So with video off, I don't know that you'll be able to share.
His video's actually on.
Is it?
Yeah.
He's
Yes.
got 2 profiles.
Open.
Okay.
Just
The
look at
other
gallery
profile-
view, Becca. You might have
I'm
to,
sorry?
You might have to switch to gallery view so you can see him.
Okay, so the one that he is trying to share on, we want to make sure that that one is a co-host so that he can share screen.
Yeah.
Sure.
Can you see that?
Yes, we can see that. Fantastic. All right, go
Okay.
ahead, Dr. Melvin.
Okay. So in starting with infrared, I used the way I was taught infrared was looking at the body in sections as if it was operating individually. So what I ended up doing after learning thermography is I ended up having to relearn the more of an integrative, functional point of view. And that brought on functional infrared, which the reporting is done in a bit of a different fashion, more as a holistic point of view in how multiple systems, how they're integrated. So what is thermography? As you can see, using temperatures of the light spectrum, which, like the rainbow, we're applying to the infrared spectrum. So infrared means just below the light spectrum. Are you hearing me okay there?
Yes, we hear you. Great.
Okay.
Keep going.
And so as you can see, the portrayal of different temperatures, where white in this particular case is the highest temperature, lowest temperature is black, the violet. But a little history regarding, I think most of us know a bit about how temperatures were initially found out, discovered. And of course, it had to do with William Herschel and that group. Now, in the early days, mud would be slurred on the body. This is back with Hippocrates, slurring mud on the body to identify high temperatures in relationship to low temperatures. So this idea of using infrared really isn't anything new. It's been around for quite some time. And these are just a number of the different cameras that we had used from from contact thermography, which is where you would apply that cholesteric latex on the body, and then you would use a Polaroid to take a picture of it. But these cameras today are much, much better and easier to not only to save the image and then to enhance the image. Enhancement doesn't change the image, however. Enhancement just for our eyes to identify, much like a topographic map, that you can identify where the high temperatures are in relationship to the low temperatures. And as you can see here, up around the trapezius area, the levator scapulae, very, very notable on this image. You can see there's a little colder temperature on the glutes here. Now I'm just going to scroll down to images again. What are we looking for? Are the precursors to breast cancer are chronic inflammation, lymph congestion, estrogen dominance. So basically, what we're looking for on these skin temperatures is the correlative control from the hypothalamus to the skin, almost like looking at millions and millions of oil lights on the skin, is exactly how we're examining the body and the skin. Now, this is an example of someone going in after going into the emergency room. They did their exam, found nothing wrong with the patient, but obviously the patient's hurting. So we did this first exam, found that there were definite inflammatory patterns along the ascending colon. And then after a few days, we noticed that the ascending colon, after doing a number of treatment protocols by the patient, that you could see this distension pattern from the stomach began to appear. And so basically you're seeing just a series of imaging to give us an idea of what is going on at that particular time. Now, issues like calcification of the carotid artery, which you can't see with thermography, but it shows up as an inflammatory pattern along the carotid artery. And then that added inflammation for a prolonged period of time allows it to be susceptible for calcification. But notice that the scalenes on the same side, very contracted on that side, and that the blood that is entering the head must be allowed to exit the head. So part of these carotid related inflammatory patterns are directly related to the overcontraction and compromising effect to the subclavian vein that can cause this added pressure on that particular vein. And then, of course, this is the external jugular vein right here. And that when that blood is not exiting properly, then it creates this distension pattern of the external jugular vein. You can see the same vein on the opposite side, but much more noticeable on this side. So on the abdomen, we're looking for not only gallbladder, small intestine distension patterns, but also we're looking for ascending and descending colon related inflammatory patterns. Again, are we seeing the organ? No, we're seeing the portrayal, a sympathetic response on the skin surface that coincides with the stress of that particular organ or body part. Now, this is an old Dorex imaging. As you notice, it's quite pixelated. The patient came in after 3 months of earaches, which, as you can see, if you look at the left mastoid sinus compared to the right, that there's some definite inflammatory features related to it, and that the patient went through 3 different antibiotics only to come find out that this is usually more fungal related, not bacterial. And we also notice that the mastoid sinuses are quite active. Now, these 2 little oval spots, the patient's mouth is right. I don't know if you can see my cursor, it's right in this area here. But these 2 oval patterns are directly above where the patient lost the lower outer incisors, and that it produced this thermal marker temporarily. It's still there after so many days, but as you can see, just within a few days, that those markers still existed, but then you can see that the nasal pattern, this is a normal pattern for the nasal, and as you can see, the cheek or the maxillary sinuses recovering. Now, in temperature ranges, we're only interested in 7 to 10 degrees of imagery. Now, the camera has a capability of 250 degrees above zero and 250 degrees below zero, but we're only interested in that 7 to 10 degree range that allows us to see the skin temperature quite overtly. Now, skin almost has 100% emission means of examining, meaning it has almost an optimal imagery capability by the camera to examine the skin surface. Where again, as most x-rays, they have to run something through the body in order to create an imagery, where this is actually only examining 1 to 5 millimeters of skin temperature, but it's the reflex characteristic to the hypothalamus that allows this to work. Now, not only is the images are archived as a digital image, but they can be enhanced with using a colored spectrum. We use a rainbow chrome spectrum. The rainbow chrome has this deeper green in it, and then you have the ability to invert that digital image into a grayscale or an inverted grayscale. So again, what is thermography? It's a neurovascular test, an autonomic survey test. It's a functional test that is examining the physiological characteristic of that particular individual. And this gives you more detail about Sumio Uematsu, MD from Johns Hopkins University, in doing this examination to establish what is a norm regarding the body. And then the body's, again, these asymmetries or out of balance temperature readings are either localized readings or they're categorized as or sympathetic neurovascular asymmetries. So often when a patient comes in to get examined, they have artifacts that are produced by what they are wearing. So in order to stabilize the skin temperature, the patient has to be in a cooled room of 68 to 72 degree temperature, and that they're wearing something like a loosely fitted gown in order to delete any markers that were produced by what the patient was wearing at that particular time. So much of the calibration and maintenance of temperature within the body is particularly regulated by the hypothalamus, but it does it by using the gateway of the skin to either retain heat or allow that heat to be expelled in order to keep the body at the 98.6. So it's interesting that the body and this hot wired system from the skin that helps to stabilize the core temperature. But then what we did is we added plumb line analysis, pelvic lines, shoulder lines, so then we could generate a structural evaluation regarding the body. And it giving us an idea of the vestibular system by what the eyes, the data from the eyes, from the inner ear, but also from the proprioceptive nerve fibers, which are dominant in the upper cervical and dominant around the SI joint. So using thermography gives us an idea, is there a disruption of the SI or sacroiliac joint? Is there a disruption in its calibration or understanding of its center of gravity? And so using plumb line analysis along with infrared, I think, is a great combination in understanding the condition, the human condition, with this type of tools. Now, again, the room and its environment has to be stabilized. So ideally, the room should be 8 by 8 by 10. And then I'm just going to go down to some of the imageries themselves. And so often when the patient fills out a symptom survey, we used to have them more in this kind of view, the head and neck, whether they have headaches or whatnot, that they would indicate where their symptom was by Xing in these areas. And so I asked, this particular patient was asked to point because the patient was having stomach pain, and then was asked to point where her stomach pain was. And as you can see, most people don't know their anatomy, so it's very helpful to have the patient literally point to where some of these symptoms are located, so you have a geographical orientation to where the symptom is, which frequently the patient may or may not know where their stomach is. I'm just going to scroll down to some imaging. And you can see the way the images are structured, that we can enhance the imaging, allowing where is the highest temperature compared to the lowest. And normally the nose and the earlobes normally runs the lowest temperature, and it's frequently used in order to stabilize the head and the temperature of the blood within the head. So most examination tools, these are tools that can examine the temperature either using a crosshair examination, which unfortunately is still being used today, where it's the temperature average of one area compared to the same parameter on the opposite side. So this allows us, as you can see, there's some periodontal activity going on the right lower part of the mouth there, but I can examine this and enhance the imaging so it gives us an optimal point of view. Now, if you look at all of these images, these are all archived, saved images. And notice the one that really gives us the optimal point of view is this one that I'm circling right here. That you can overexpose or underexpose, but it doesn't change the temperature when you're changing the positioning of that 7 to 10 degree range, up or down that 500 degree range of positioning. It can either be real black or real white, depending on where you place that your temperature range. Now, this is just an example of someone that they used a 3.9 degree range of temperature. And as you can see, you're losing some of the data. This is a much better imagery done at a 7 degree range of temperature or span. And then there again, you can see on in the close to the middle here that this is where you could produce an entire range of temperature that's all black or all white. But as you can see, the temperatures are exactly the same on the inner canthus of this eye here. In breast imaging, normally what we're doing is we're doing 6 images. There's an anterior breast, a left and right lateral, a left and right oblique. Most of the imaging and examination is particularly done on the oblique views where the nipple temperatures are examined best when the nipple is facing the camera. So as you can see, these are some of this is an example of a case where the range of temperature was supposed to be at 7 degrees, but this patient, whoever shot this, shot it at, I believe, at 11.5 degree range. So this span is 11.5. Now compare it to the face view here compared to this view here at 7 degrees. So what are you getting is not a change in temperature. You're getting a change in a visual perspective to where now you can see where the highest temperature is in relationship to the lowest temperatures. Now, some individuals, you can lose a little bit of data, but if they when you have this much of the higher temperatures represented, but if the patient has a cold or a flu, frequently this is exactly the way they look. So our imaging, we start from the bottom of the feet. We do the extremities first, and then we do the neck, and then the full torso is done. And notice that the imagery is where the camera is on its side. So now when we do a full spine image, we would have to be at 7 feet in order to get the entire spine in the image, where by turning the camera on its side, you're now at 5 feet instead of 7, which enhances the imagery because you're just basically closer to the patient. And then we flip the camera right side up, finish all the images where the camera, the pixel resolution is 320 if you're using a 300 series camera, and 240 high, where most of these images here are all done 320 high, 240 wide. And then we load our images on a page which includes the image and the report. So as you can see here, in the old days, most of the imaging was set up in blocks of 1 to 16. So the temperature span would normally be at 8 degrees, allowing a half a degree per pallet there. And this is where in the old days, frequently you read by sight in knowing what these ranges of temperature were about, where now the resolution of the imaging, this is a 600 series, 640 pixels by 480 pixels, where in the old days, you would have to do a colored scale, and then you would have to also have a gray scale, which gave you 256 levels of gray. And then for the breast imaging, we frequently will include an inverted gray scale, which allows the linear patterns to be seen better. But as you can see, that need of duplicating the infrared is no longer needed other than breast imaging regarding vascular characteristics. So this temperature range here was at 7 degrees compared to 15 degrees. So the quality of the imaging is enhanced by what span are you using at that time. Now, in our situation, what we are doing is 6 images. The first is the anterior breast, left and right lateral, left and right oblique, and then we repeat the first image on the bottom right is what you're seeing here. And then we're looking to see how did the tissue respond within that 4 or 5 minutes from the first image to the last image to identify how did the autonomic nervous system respond in that environment of 68 to 72 degree temperature. Now, our standard of imagery will do all 6 of these images and include one full torsal image as a complete breast image study. And these are some examples of it. You can see here, our software is one of the only softwares that will give you a delta T on the image. So as soon as you circle the nipple and areola and then circle the global temperatures, it immediately transfers the same size parameter to the opposite breast. And then they're positioned properly to correlate the right nipple to the left nipple. And so what you're seeing here is a delta 0.45 or a delta negative 0.01. Now, in regards to showing a before and after regarding implants, what does that look like? How does the tissue respond? And again, neurologically, the skin is still contacting the hypothalamus, identifying what the temperatures are, even though the implant is a little disruptive. It does cause a little bit of lymph congestive characteristics. So I'm showing you before the implant, after the implant. But the only time you really don't see a proper image regarding implants is if the implant is overly fitted to the tissue. So you're seeing the first images with the implants, and as you can see with the overstretching of the tissue, that you don't get a proper image, where this is after the implants have been removed. So you can see, and this is an example of a case that was surgically, the lesion was removed. On this one, you can see the top left compared to the bottom right. This is after the biopsy, and this is before. Now, this patient had 3 surgeries of the lower back and still was complaining of a left gluteal pain. And so she was told that it was all mental, that it was an emotional disorder, where literally when you see this reds is that the autonomic nervous system has been compromised and that it shows up hot like this. This is, again, a before and after neuropathy down the right arm into the hand. And you can see structurally how far off center. So what we did is not only treated the patient, but put a heel lift inside the right shoe. This patient does have an anatomical short leg, and you can see the response. That neuropathy that went down into the arm was relieved not only with using the heel lift and using a wedge to sit on to lift this right side, but also I taped the shoulder, had the patient lift the shoulder up, and then taped the shoulder with surgical foam tape, which within 2 to 3 hours, the neuropathy was much improved. This is more, you can see one is sitting, one is standing. And as you can see, the standing, much more of a left lateral displacement of the frame. And you can see that the facets are quite active, the articulating facets. We've already seen this one. Now, frequently, the body can create new lymph or venous channels. And as you can see, this is something that's been produced later on in life. And you can see how different it is compared to the other view. Now, fibroadenomas tend to be in the colder sections of the breast. And this is an example confirmed with ultrasound and biopsy. And this is a much more aggressive characteristic regarding the breast. Now, this patient, there's a particular artifact, a thermal marker that shows up when there's stress to the coronaries. And this is the pattern that does show up. We saw this early on, and within, I would say it was about 2 months, he had a heart attack within 2 months of this image. And again, this is an older Dorex unit. And here, headaches frequently are quite visual. So, and you can see the imaging is quite overt. Thyroids, if they're enlarged, they show up in this particular fashion, a distension. Issues regarding diabetes, frequently you'll have this red glove appearance on the hands. And if there's any questions, I can stop at any time to address them if you'd like. This is an example of prostate inflammatory patterns. This particular patient has hepatitis C. Even though you can't diagnose them from the imagery.
It is amazing what thermography will show. I mean, as you're going through all these different images and then just, the settings that can be chosen with the different ranges on temperatures, it's incredible.
Yes.
So Dr. Melvin, we've had a couple comments. So one, Anne has had thermography instead of mammograms a couple times, and she said she learned so much, even was able to then address a lymphatic drainage issue.
Yes.
That she was having that would have never been shown on a mammogram.
Yes. Yeah, and that lymph characteristic and the importance of lymph circulation and being able to visualize it, and then and to guide the patient on what they can do to enhance those particular features. But notice, this particular patient was put on a vibration unit for 10 minutes, and it's thought that it should return the lymph back to the heart and circulate the lymph properly. But frequently they have a problem with the way that they're breathing, in that if they're breathing from their chest rather than diaphragmatic breathing, frequently the interference is an improper diaphragmatic breathing is producing the issues. And also what we're looking for is you can giving the nutrition to the body so then it can heal itself, but also you can visualize things of how well is the body assimilating, how well is it digesting and eliminating. And so it can give you those kind of details that you wouldn't normally be able to see. And these individual had stents put in, and as you can see, is severely bloated. When they don't produce enough hydrochloric acid to break the food down, and it's almost like they got a balloon in their stomach pushing up against the diaphragm. And as you know, the pericardium, the sac to the heart, is anchored to the diaphragm, so that pump, when it drops and raises, literally massages the heart.
Wow. And that was something else that Anne mentioned, that it showed that there was inflammation in her digestive system, and then she knew that the digestive system needed to be worked on as well.
That's right. And so obviously the nutrition is important, and at the same time your assimilation is predicated on how well are you digesting the food. And so what you're seeing here is a bloating pattern where the ileocecal valve, which is about 2 inches below, 2 inches to the right of the umbilicus, when that valve doesn't open properly, then you get this lingering of digestive fluids either in the stomach or in the small intestine, or you develop a flora that's not so helpful in the colon. Like this one.
Wow.
Here you can see this patient, they were going to do a colonoscopy examination and was told that her colon was so torturous that she should never do a colonoscopy because of the fear of puncture. And you can see just how disfigured this colon and how inflamed. This is after using cleansers, digestive cleansers, to clean out the digestive tract. Well, this patient, she ended up dumping a stone. The marker only showed up for a short period of time, and so she was up most of the night. And so we did that image that very morning, and then you can see just a few days later that the marker is almost totally gone. This is an example of stones that are produced within even the liver, not just the gallbladder.
So our next question, Dr. Melvin, has
Yeah.
to do with wanting to know what color would cancer tumor tissue show up as?
Yeah.
Would it be hot or cold, or does that?
Like I said, I showed you one extreme form of a breast image a little earlier, but let me see if I can't get to another one here. Sorry. Yeah, what it would be is one, it's an organized capillary growth. We saw one earlier here. Let me just showing you all the variances that you can see regarding the infrared.
Well, I have messages coming in saying, wow, I need to do this. This is great information. Thank you. Some people are wanting to know where you're located.
Yeah, well, we're retired, but we can assist in that format. But as you can see, the wide range of capability, estrogen dominant characteristics.
It's amazing what the temperatures of the body will tell us.
Yeah, these are examples of an estrogen dominant characteristic where you get this branch like heat pattern that will radiate towards the nipple. But most of these will also have an active parotid. Salivary glands will be quite active in that it will pick up some of the slack on getting rid of the estrogen by way of the salivary glands. This is another example. You can see how active the salivary gland is and this estrogen dominant characteristic. So those that have lesions have much more related to this kind of markers, but it's organized around the lesion. And 70% of breast cancer does occur on the left breast, and 70% of those occur between 12 o'clock to 3 o'clock. And what is the common denominator actually has to do with arm dominance. Most women are right arm dominant, causes a compensatory tightening of the left scalenes, which can cause an entrapment of the subclavian vein. Now, this is an example. This is after breastfeeding. She's just finishing on breastfeeding there. This one had an implant that ruptured and repaired. This one looks like it's leaking. This one's leaking.
Wow. So we have some more questions. Do insurance companies cover this type of imaging?
Yeah, it depends. At a time, we used to get a lot more that they did. I tend to run off of a cash basis, so and have been for many years. So, but some of them do. Some of it just depends. I know that Aflac does pay for breast imaging because they found it so helpful in prevention. Aflac.
Excellent. And we have another question wanting to know approximate costs if you were to pay out of pocket. I know it's
Yeah.
going to range from area to area.
Yeah, it does. And we for breast imaging, it's usually $250 for the breast imaging. But again, we do 7 images. It's always to include a torsal image because, as you can see, the torsal gives us a lot of ideas regarding the breast. And as you can see, look at the activity around the breast on that left side, and then look at the inflammatory features on the descending colon over the stomach. And you can see as it improved, the breast improved. Are you seeing that there?
I do see that. So
Yeah.
as we're looking at this image that you have on the screen right there,
Yes.
I'm looking to see, are they different date? Oh, I do see there's
Yeah,
different dates there.
Yeah, the timestamp is on every image. This was done in 2018. The next one, the timestamp is right here, 2019, 2021. And
All
then
right.
this is the oblique view, so you could see those inflammatory lymph congestive features even better.
Now,
Go ahead.
AJ is saying that there's very clear, the benefits and uses of thermography. He's wanting to know what are the current FDA stances on the use of this technology.
Well, I tell you, they have a. It used to be that up until 1996, I believe, that thermography could be used as a sole examination tool for breast imaging, but that no longer is the case. So adding in ultrasound, I think you can get most of the entire breast with ultrasound So we are advocates of the ultrasound in conjunction with infrared.
And here's a question for you, Dr. Melvin. I know that you're retired. I know that you do still do the thermography. If somebody wanted to travel to the greater San Diego area, are you open for new consultation?
Yeah, we could do that. Again, we're headed out to the East Coast fairly soon, but we have people around the country that's doing the imaging.
Oh,
So-
excellent.
So we can forward. They don't have to come across the country to see us. So we can find out what their need is, and then see if we can find somebody close to them.
Okay, so if somebody did have a need and wanted to reach out to you, how would they do that?
Yeah. Well, again, I'm trying to be retired. I mean, it's a pleasure. We can work things out to let them know how that would look like.
Okay.
But I'm trying to be retired.
Well, and you've worked a few years, so like
Yeah.
Dr. I think you've earned a little bit of rest, relaxation, and retirement. If that's where you want to go.
Yes.
I have one more question, and it says, is this an alternative to a colonoscopy?
I can't say that, but what I'm very leery on for myself regarding the colonoscopies. I have a few cases in here of the rupturing of the colon or compromising the colon for the procedure. But again, I think this information gives us a much better detail well beyond the colon. So it's given us detail regarding stomach, uh, small intestine, ascending, descending colon, related features. Just look at the before and after on this one case, and you can see that there's, in this particular case, a high probability of parasitic related issues when they look this active.
Okay, so with that being said, I mean, that's giving an indication of where nutritionally
Yep.
you need to go in order to address issues.
Yeah. It brings all of those elements, which in our reporting, certainly selenium and iodine is much of it's pretty much an ongoing recommendation because it's a problem.
Absolutely. Well, Dr. Melvin, we are coming up to the top of the hour. Actually, we're past the top of the hour. We thank you so much. I'm going to go ahead and end your screen share here and
Okay.
bring you on with me. Actually, I can't do that. Ruth Ellen, can you end the screen share? And let's go ahead and do Dr. Melvin and I on the screen, please. Awesome. Well, thank you so very much. So
Thank
much
you.
information. I have people saying, this is fantastic information. Thank you. And this is so interesting. I mean, I've lost one of my screens with extra information. Oh, let's see. Wow, show and tell. So this is before and after pictures, people. When it comes to what the body looks like, looking at those temperatures, and then as Dr. Melvin was showing, befores and afters, where there were treatments, including nutritional things, that contributes to our overall health and well-being, with pictures to prove it.
Yes.
I love that. Absolutely love that, Dr. Melvin. And thank you once again for taking time out of your schedule. I know you're trying to retire. But I appreciate, the thermography that I've had with you. I have some more coming up here shortly where folks, you don't know what you don't know.
Yeah.
You really don't. And seek out other alternatives like Dr. Melvin. I mean, yes, doctor of chiropractic, but doctors of chiropractic are going more into some of these other specialty things that just add to their ability to help their patients on an even grander scale. So how do you feel that thermography has helped you in your chiropractic practice? Because we've got a lot of people of the alternative modalities that are part of our program, part of our viewership. How do you see this as being an asset to you?
Yeah, I would say that comparing when I was doing radiology at a time, that the enhancement of this type of imagery and the integrativeness of point of view, where we're looking at the body more as an integrative system rather than in pieces. And so in the writing of the reports, I write them more about the causation of these heat patterns. How are they occurring? Rather than just noting that there's a hot spot here, hot spot there. That it doesn't do any good to the patient or the doctor as far as understanding origin, when most of the devices frequently don't have that capability. The assumption is that if everything looks geographically normal, then it should operate normal. And we know that that's just not so. That you can do an MR or a CT scan, X-ray, everything looks normal, but it doesn't tell you anything about how it's acting. And so this is why it's really not as so much as a diagnostic tool, it's an analytical tool that gives you an integrative point of view. So, and then by doing that, you understand the human condition, where the condition outweighs the localized tunnel vision of a diagnosis. The diagnosis frequently falls short. Chiro's, in its basic philosophy, is a diagnosis falls short of the understanding of the condition. The condition is much more complex.
I love that. And I think that's a great place to close, Dr. Melvin, because so many times people will receive a diagnosis and they think that's just the way it is. You either throw some chemical pharmaceuticals at it or you're stuck with it.
Yep.
But this thermography goes more into that analytical side as to, okay, what's really going on? What can be addressed and done differently to help what the diagnosis was?
And you can monitor it, so without harming the patient.
Without harming the patient. What's that Hippocratic oath?
Yeah. Yeah.
Do no harm.
Yeah.
Well, Dr. Melvin, thank you again so much for joining us here today. I greatly appreciate you and all that you do. And we pray that you will have a wonderful retirement, working when and if you want to, and just enjoying life.
You bet. Thank you for having me.
All right. Thank you, everybody, for joining us here today. I think that there's a lot of people that kind of had an eye opener as to what's going on in the body. Lots of color. I love color. And man, it's amazing. I got some thumbs up here from Dr. Judy here in the gallery with us, also loving the colors. being able to, get a view of, what's really going on when it comes to temperatures. As we think of, inflammation, adding a little heat, neuropathy, and not having so much heat. But this actually gives you an idea of what's going on, whether we can feel it or not. And even if we're feeling it in a different spot than what, like he mentioned, not really truly knowing the anatomy and where things are, the thermography gives a greater insight as to location. And then you work with somebody that knows what they're doing, who has information and knowledge about Dr. Wallach's program and the importance of nutrition. Folks, just one more thing that you can do as part of you taking control of your own health and having those things in your toolbox to help you obtain or maintain optimal health. We have gone a little bit over, but if I could get my co-hosts on with me today, I just want to thank them as we were working through getting everything lined up. I saw AJ doing a little bit of coaching as we were getting the presentation up on the screen for us. So thank you for doing that as well. We have Ruth Ellen, who was helping make sure that everything was connected and keeping us organized and on time. We have Marilyn, who is putting some great information into the chat. So thank you, Marilyn, for putting that as well. And Sherry helping let everybody in, keeping an eye on those cameras. As folks, we want to make sure that this is a safe place that you can come into and just be able to enjoy and focus on the program that is being brought to you. I love the fact that we have so many coaches that are joining us on our programs so that they too can get this knowledge so that they can better know what's available to help their clients as well. So thank you, everybody, for being here with us on Daily with Doc. My name is Becca Dukes. Tomorrow we will be having another special guest. We will have Dr. Joyce Hunt Brown, who I'm super excited about. She has several different doctorates coming from a background totally not medical related. So she has this broad insight on life, including trauma, folks, and how trauma can affect our lives, but we don't have to be stuck in that trauma. So if you know anybody that has been affected and almost paralyzed because of different situations that happened in their life, and that can be paralyzed to any degree, just whether it's stepping outside the house, whether it's trying something new, she has a specialty where she's been working with teens and young adults that have been trapped in this sex trafficking that's been going on. So I really encourage you to join us tomorrow, or if you're watching the replay, do a search on our critical health news channels or Daily with Doc channels. You will definitely want to watch that program with Dr. Joyce Hunt Brown. Again, thank you to Dr. Melvin for his time, and thank you for all of you and investing your time in getting the tools and knowledge to help yourself. Now, for the nutrition, you want to make sure that you get back with the person that you helped you find this program. If there is nobody to thank, make sure that you go to DailywithDoc.com and you can click on the option for a free 15-minute health consultation. And that is for people that have never worked with anybody before. We'll get you teamed up with one of our certified holistic health coaches. And then we also have an option there that has What Should I Take, which is a breakdown of our 90 essential nutrients, plus the secret sauces for specific conditions if you've got a specific concern. And we have the good foods, bad foods list on our website, also at dailywithdoc.com. Look for that good foods, bad foods list where you're eliminating those inflammatory foods and adding in the foods that actually support positive. I hate this that we have to keep things compliant. Regrowth of cells, because our cells are, populating every single day. And the healthier we put the nutrition that we go into the body, the healthier the cells have the opportunity of becoming. So until next time, bye for now.